On Friday, health officials announced the Chicago area has risen to a medium risk of spreading COVID-19. Infectious disease expert Dr. Robert Citrenberg is back with us this morning from Advocate Aurora Health. Doctor, good to see you. Good morning.
Good morning.
So what in the world is going on here and why is it happening?
Well, I would tell people not to overreact. The numbers that they release, the metrics are actually based on the rates of hospitalization in our area, which have ticked up ever so slightly over a threshold. There's no meaningful change in how we're approaching COVID. We're not imposing any different standards or recommendations at this time. Just more of an awareness that COVID is circulating a little bit more in our communities as expected. As the weather gets colder and people spend more time indoors, we expect there to be some more transmission. The good news is that the risk of serious illness, hospitalization, and death are extremely low and remain so, particularly in people who are vaccinated and boosted.
Dr. Citrenberg, it's less than 2 weeks now until Thanksgiving, and judging by vaccination rates, a lot of people that you might be having a holiday meal with are not up to date on their COVID and flu vaccinations. What's your advice for families?
Yeah, Tanya, that's such a good point, because we know that with all the controversies over COVID vaccines, the general interest in vaccines has gone down in both adults and children. It's very important for people to get vaccinated, to get boosted, and especially get their flu shot, since we're seeing an awful lot of flu right now. But I think the single most important lesson that I'm hopeful that people have learned during this last 2.5 years or so is that don't go places when you're sick. Don't go to work, don't go to gatherings when you're sick. Even though we know that occasionally people can transmit the disease when they don't have symptoms, by and large, people transmit this disease when they are sick. So in the past, we used to go maybe with a box of Kleenex and take some cold medicine. Best advice, if you're sick, don't go. You can go next time.
So if you're sick, stay home. There it is.
And a lot of people are sick right now.
Speaking of, a lot of kids, you just mentioned this, Doc, sick with RSV. It's flu season. We're talking about COVID right now. Are you concerned about the hospital system being strained?
Terrell, not at this time. Right now, it looks like the RSV infections are starting to peak, which is good, because the last few weeks have been very difficult on children's hospitals, both in our area and across the country. I think really more than COVID, I'm concerned about flu right now, because the rates of flu in our community have skyrocketed in the last 2 weeks, and flu hospitalizations actually are up. I do not believe we're anywhere close to a point where that will affect hospital operations, but it's something that we continue to monitor every day. So right now, I would say flu is our biggest challenge, our biggest concern, but this is something that we monitor. And of course, if anything changes, we'll give additional recommendations. But the best strategy right now, again, is to get that flu vaccine.
Dr. Robert Citrenberg, always appreciate your time and your advice. Thank you, sir.